About 1% of all pregnancies are complicated by pregestational diabetes, either type 1 or type 2 diabetes. While pregestational diabetes is not a contraindication to pregnancy in most women, such pregnancies are considered high risk and they can be associated with an exacerbation of many diabetes-related complications. These pregnancies can be a little bit more complicated. Pregnancy outcome is best when glucose control is achieved before conception and in the absence of vascular disease, and that means disease of your vessels. Major congenital anomalies are the leading cause of fetal and infant mortality in pregnancies complicated by pregestational diabetes, and they occur in about 6 to 12% of infants of women with diabetes. Poor preconception glucose control or poor sugar control prior to pregnancy has been linked to spontaneous abortion and to an increased rate of congenital malformations in the baby. It is very important for women with pregestational diabetes contemplating pregnancy to establish early preconceptual care with a health provider. Preconceptual counseling and treatment should focus on achieving very good blood sugars prior to pregnancy. Patients should be evaluated for vessel disease, and your health provider may request an eye examination, for instance, by an ophthalmologist, a 24-hour urine collection to assess your kidney function, and maybe an electrocardiogram to make sure your heart is fine. As many as 40% of young women with type 1 diabetes mellitus may have thyroid dysfunction, and your health provider might order tests to make sure your thyroid is functioning well. 400 micrograms daily of folic acid should be prescribed to all women contemplating pregnancy. This is particularly important in women with diabetes, given their increased risk of having a baby that might have a neural tube defect.